The Hispanic and Latino Community and Hearing Access, a presentation by Genesis Ayala, supervised by Dr. Andrea Reed. Before we get started, let's clarify some things. What's the difference between a Hispanic and a Latino? Well, a Latino is a person from any of the countries located in Latin America. These countries include Brazil, French Guiana, Guadeloupe, Martinique, Haiti, St. Barthélemy, and St. Martin. Now, a Hispanic is a person from a Spanish-speaking country such as Spain. So, because I am from Mexico, I am both a Latina and Hispanic since Mexico is geographically located in Latin America and is also a Spanish-speaking country. Did you know that the Hispanic Latino community makes up 19.1% of the population in the US? That's well over 63.7 million people. We are the largest racial ethnic minority in the United States. While there isn't much specific data on hearing loss among Hispanic Latinos in the United States, some studies and data suggest that 1 in 7 Hispanic Latinos living in the US have hearing loss. According to research published in 2021, it was found that Hispanic Latinos in the United States are less likely to use hearing aids compared to non-Hispanic white adults. Almost 50% of the participants in the study were not wearing hearing aids to treat their hearing loss. Why is this happening in our community? Let's talk about some barriers. While the list can go on, let's focus on the first 7 that come to mind. Language and communication. Limited English proficiency among members of the Hispanic Latino community can make it challenging to communicate effectively with healthcare providers, particularly when discussing complex medical issues like hearing loss and treatment options. Lack of awareness and education. Many individuals in the Hispanic Latino community may not be aware of the signs and symptoms of hearing loss or the importance of early intervention. Lack of education about hearing health and available resources can contribute to delayed diagnosis and treatment. Limited access to healthcare services. Socioeconomic factors, including lack of health insurance, limited access to healthcare facilities, and financial barriers, can prevent individuals from seeking hearing healthcare services. This is particularly true for undocumented immigrants and those with low incomes. Transportation and geographic barriers. Limited access to transportation and healthcare facilities in rural or underserved areas can make it difficult for individuals in the Hispanic Latino community to access hearing healthcare services, including screenings, evaluations, and follow-up appointments. Cultural stigma and the cost of treatment. In many Hispanic Latino cultures, there may be a stigma associated with wearing hearing aids or seeking treatment for hearing loss. This stigma can prevent individuals from seeking help or acknowledging their hearing difficulties. Hearing aids and other assistive devices can be expensive, and many individuals in the Hispanic Latino community may not be able to afford them. Even with insurance coverage, out-of-pocket costs for hearing healthcare services and devices may be prohibitive. Cultural competency of healthcare providers. Healthcare providers may not always be culturally competent or sensitive to the needs of Hispanic Latino patients, which can affect the quality of care they receive. This includes understanding cultural norms, preferences, and communication styles within the community. Now, I would like to touch upon some extra sensitive topics that are the most often forgotten about when dealing with a Hispanic Latino patient: the fear or mistrust of the healthcare system, and immigration status concerns. Due to past experiences or cultural factors, some Hispanic Latino immigrants may have a fear of or mistrust of the healthcare system. Historically, the mistreatment or exploitation of minority populations by the healthcare system has contributed to a general mistrust of medical institutions among minority communities. Many undocumented Hispanics Latinos fear that seeking healthcare of any kind may result in their immigration status being discovered, which they know can possibly lead to deportation or other legal consequences. By implementing strategies to combat all these barriers, audiologists can play a vital role in addressing hearing healthcare disparities and promoting better hearing health outcomes among the Hispanic Latino community. Collaboration with community organizations, healthcare providers, and policymakers is also essential for creating systemic changes that support equitable access to hearing healthcare services for all populations. Espero que les haya gustado mi presentación. Muchas gracias. Adiós.